Prednisone is a corticosteroid used to treat inflammation or immune-mediated reactions and to treat endocrine or neoplastic diseases. In this video, let's found. What is prednisone? What class of drug is prednisone? What is prednisone used to treat? Who cannot use prednisone? What are the side effects of taking prednisone? How does prednisone make you feel? How to use prednisone? What is prednisone? What class of drug is prednisone? Prednisone is a glucocorticoid medication mostly used to suppress the immune system and decrease inflammation in conditions such as asthma, COPD, and rheumatologic diseases. It is also used to treat high blood calcium due to cancer and adrenal deficiency along with other steroids. It is taken by mouth. Prednisone was patented in 1954 and approved for medical use in the United States in 1955. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. In 2020, it was the 30th most commonly prescribed medication in the United States, with more than 19 million prescriptions. What is prednisone used to treat? Prednisone is indicated as an anti-inflammatory or immunosuppressive drug for allergic, dermatologic, gastrointestinal, hematologic, ophthalmologic, nervous system, renal, respiratory, rheumatologic, infectious, endocrine, or neoplastic conditions as well as an organ transplant. Who cannot use prednisone? Prednisone is contraindicated in patients with documented hypersensitivity to the drug or components of the formulation. Contraindications to the administration of prednisone include the presence of systemic fungal infections. What are the side effects of taking prednisone? Short-term side effects, as with all glucocorticoids, include high blood glucose levels, especially in patients with diabetes mellitus or on other medications that increase blood glucose, such as tacrolimus, and mineralocorticoid effects such as fluid retention. It also causes depression or depressive symptoms and anxiety in some individuals. Long-term side effects include Cushing's syndrome, steroid dementia syndrome, truncal weight gain, glaucoma and cataracts, diabetes mellitus type 2, and depression upon dose reduction or cessation. Long-term steroids can increase the risk of osteoporosis, but research has found that few of these people were taking medications to protect bones. Prednisone also results in leukocytosis. Pharmacodynamics. Corticosteroids bind to the glucocorticoid receptor, inhibiting pro-inflammatory signals and promoting anti-inflammatory signals. Prednisone has a short duration of action as the half-life is 2 to 3 hours. Corticosteroids have a wide therapeutic window as patients require doses that are multiples of what the body naturally produces. Patients taking corticosteroids should be counseled regarding the risk of hypothalamic pituitary adrenal axis suppression and increased susceptibility to infections. How does prednisone work? Prednisone is first metabolized in the liver to its active form, prednisolone, a glucocorticoid agonist corticosteroid. The short-term effects of corticosteroids are decreased vasodilation and permeability of capillaries, as well as decreased leukocyte migration to sites of inflammation. Corticosteroids, binding to the glucocorticoid receptor, mediates changes in gene expression that lead to multiple downstream effects over hours to days. Glucocorticoids inhibit neutrophil apoptosis and demargination. They inhibit phospholipase A2, which decreases the formation of arachidonic acid derivatives, inhibit NF-kappa B and other inflammatory transcription factors. They promote anti-inflammatory genes like interleukin 10. Lower doses of corticosteroids provide an anti-inflammatory effect, while higher doses are immunosuppressive. High doses of glucocorticoids for an extended period bind to the mineralocorticoid receptor, raising sodium levels and decreasing potassium levels. Half-life. Prednisone and its active metabolite prednisolone have half-lives of 2 to 3 hours from both immediate and delayed release preparations. How to use prednisone? Glucocorticoid responsive conditions. 5 to 60 mg/day PO in single daily dose or divided Q6-12 HR. Dosing considerations. When converting from immediate release to delayed release formulation, Note that delayed-release formulation takes about 4 hours to release active substances. Note that exogenous steroids suppress adrenal cortex activity least during maximal natural adrenal cortex activity, between 4 o'clock and 8 a.m. Acute asthma. 40 to 60 mg/day PO in single daily dose ordered Q12HR for 3 to 10 days. Giant cell arteritis. 40 to 60 mg PO Q-day, 1 to 2 years usual duration of treatment. Idiopathic thrombocytopenic purpura. 1 to 2 mg/kg/day PO. Advanced pulmonary tuberculosis. 40 to 60 mg/day PO, tapered over 4 to 8 weeks. Autoimmune hepatitis. 60 mg PO Q-day for 1 week, then 40 mg Q-day for 1 week, then 30 mg Q-day for 2 weeks, followed by 20 mg. Give half this dose if giving in combination with azathioprine. Are there specific concerns about prednisone and pregnancy? US FDA Pregnancy Category D. There is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about prednisone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.